engineer. He's a co-founder of Rex Bionics, which is looking at I suppose, a mechanical solution to people with mobility differences. Robert is a member of the committee of MS Auckland, and I welcome you to the stage. Rex Bionics has recently been acquired by a British company and is now listed on the London Stock Exchange. For those of you that like new technology companies and have a little bit of money to spend, it might be a good bet. That's not a recommendation from me. Robert.
Thank you, Neil. We did intend to have somebody demonstrating the machine, but unfortunately he took unwell yesterday and won't be here. My closest friend, business partner, Richard Little, who, without his passion and, quite honestly, sheer bloody mindedness, we wouldn't be here with this machine. He's much more up to date with the physiotherapy aspects of this, so I'm going to hand over to him. You'll be pleased to hear, and he can say a few words.
Just stop the beast from falling over there. Good morning. Thank you very much for inviting us along to talk today. Physiotherapy was a bit of a surprise to us. We actually started this device in 2003 when Robert was diagnosed with MS, and we were thinking about mobility and about our jobs as engineers. Sorry, I'm huffing and puffing from lifting that thing. Robert's an engineer and wanted to stand and work, and we were thinking about wheelchair and his mother using a wheelchair from having had MS. And we thought about building a set of mechanical legs. We can't fix MS, unfortunately. We're engineers, not doctors. But we thought we could build a set of robot legs. And as boys do, we took to the garage and started building a pair. We thought we were dealing with a mobility issue. Thought we were talking about walking and standing and getting around the workshop and all those types of things. And we very quickly learned as time went on. A lot of people who came to us were spinal cord injury, particularly, make up a very large group of people interested in Rex. And what we found was there was a lot of secondary medical complications of using a chair and immobility, and that became a big drive for people to look at Rex. And so that was the group that we were seeing the most. But along the way, probably 4 or 5 years ago, when I was talking at medical conferences on rehabilitation in the States particularly, where there's an awful lot of activity, nobody knew what an exoskeleton was. I would drag this machine along and people wouldn't understand what it was, and they would come and they would talk to me. And last year I was in Missouri and we had a big rehabilitation conference there, probably one of the biggest in the country, and about 25% of the time was spent talking about exoskeletons, what we might use them for and how they might be useful to us. And physiotherapy is one of the things that's come up, robot-assisted physiotherapy. And we just got ethics approval actually in the UK just a couple of days ago, this week, for a 100-patient trial, where we're looking at studying the effects of doing some of the robot-assisted physio. And really the guts of it is that you can stand in the machine and get into positions that you might not otherwise be able to do, and it's controlled, and it's actually safe and easy for the physios. It's a very low-impact form of exercise. The machine carries most of the user's body weight, and it allows the user to stand in the machine, and the physio can get them into whatever positions that the physio wants to get them into. And where sometimes we've had 3 physios working with a patient, now we've got 1 because the machine's taking over all that exercise and all that effort for them. And it's very comfortable, and it kind of came about as well, partly because we used to do this lazy robot yoga, we used to call it. When we were standing at conferences, we would stand in a machine, and it's not sort of easy to do that and talk at the same time, but we'd stand in a machine and you'd get halfway through a walk. We like standing on one leg. People think that's very comfortable for some reason. And we would start putting our leg up in the air and leaning back and standing like this. And it was just this thing that we were doing. And it felt really good to us, able-bodied demonstrators, I suppose, in the machine, but then the users were finding it very comfortable. You find all these people standing in robots on one leg with one leg up in the air and their arms out like this. And the physios clicked onto this, and they've actually taken this up as a form of treatment now, and it's been used around the world. We've got that trial is going to be spread around in America. There's a little bit down here in New Zealand. There's some in Australia, some in the UK, and there's potentially a couple of sites opening up, one in Benelux and one in Denmark as well. So it's something that's actually taken off around the world, and we'll do bigger trials as time goes on. I always hate talking and the sound of my own voice and things, so it's a really good idea just to ask questions too. We can take the machine down and have a wee walk. It's quite hard to sort of see. We might do that at the end of the presentation. But does anybody have any questions about what we're doing and why we're doing it and how we do it? How much are they? They're bloody expensive, actually. They're £80,000, $150,000. $150,000 New Zealand. There's an awful lot of technology in them in it. The part of the AIM listing that we did last year allowed the company to be fully funded again and for us to expand, sell more into bigger rehabilitation centres and hospitals rather than to individuals. And hopefully with that increase in volume, we'll be able to drive the price down. We have a new development program in place now where we're looking at the next generation machine. This is effectively a 10-year-old machine from started in our garages. And we're looking at the next generation, much smaller, faster, lighter, and hopefully half the price. You can go up and down stairs, you can go up and down slopes, yep. We don't have many falls. The machine's inherently stable, so one of the things we didn't want to do was have a machine that was relying on electronic wizardry and software. We've all sort of had a blue screen of death with Microsoft, you know, so we all know that software can go wrong. So what we wanted was a machine that was actually stable on its own without any electronics working on it. So if the machine fails or stops at any time, it's perfectly well balanced. At any point during the walk, we have had some falls. We've had 5 falls in 13 years that we've been doing this now. My funniest fall story, we've never had anybody injured, but my favourite, I had a customer from Canada who had a C4-5 spinal cord injury, so up at the highest level. This guy's a 24-hour attendant care, electric wheelchair, and all that sort of stuff. And he phoned me on a Monday morning and said, I fell in my Rex. And it's a call that you don't want to get. You don't want to know that anybody gets hurt in your machine. People get hurt in all sorts of machines. And I was thinking, oh, it's not the story I want on a Monday morning. What happened? He said, oh, it was great. He says, I was drunk at my cousin's wedding dancing. I said, what happened? He says, my friends picked me up and we carried on. And the machine's actually designed to take the impact of a fall. So the side of the machine there is all plastic covers. It absorbs as much energy as it can. When it falls, the covers shatter, and that hopefully takes most of it. The worst that we've seen really is a little bruise in the hip as somebody goes down. You protect your head, same as you do if you go backwards out of a wheelchair. So it can happen, just as people can fall without a machine, but generally speaking, it's not a dangerous thing. It's probably the coffee table that will get you. Anything else? Yes, ma'am.
Who's that? Sorry, I just wanted to know, that machine is designed with who in mind? Initially, did you think of people who are in wheelchairs, or what did you have in mind when you came up with this design?
When we initially had it in mind, really, it was Robert that was driving the thought process. And that was from our poor experience at the time. We were thinking particularly of Robert's mum has MS and used a wheelchair. And we were thinking about wheelchairs, and my mother had had a stroke at the time and was using a wheelchair at the time. And what struck me personally about that was the change in access and attitudinal barriers that she was facing as a wheelchair user. So my mother, as I like to sort of say, was a big, strong farm girl. She was a terrifying woman. She could, to the day she died, on her deathbed, you know, she could only move like one eye, but she could still chastise my brothers and me. Even though she couldn't speak, you knew you'd done wrong, you know. Not that we were doing anything wrong when she was dying, but, you know, she was a powerful woman. And to go from that to when she was in a wheelchair, and I noticed we'd go to cafes and people would hand me the change. When she bought a coffee, they'd ask me what she wanted to drink. This is stuff that people in the room might know better than me. And that just really upset me. And so we just purely looked at a mobility issue. But we didn't want to differentiate by illness or injury. It was about somebody who was mobility impaired could get in a machine and it would give them some assistance. Now, we had to limit the functionality of the machine because of cost. This is a really expensive technology to develop. It's really expensive to purchase at the moment as well. But we've probably put, I have lost track, but there's probably some $30-odd million in this machine now to develop it and the technology that surrounds it. But what we were looking at was just assisting people with mobility impairments. This is one thing that we've done. I like to say that we're good at 3 things. We do robotic devices, complex electromechanical devices, and we fit humans and robots together. And some of our most exciting work is around arm rehabilitation and rehabilitation of people who are still in an intensive care unit. They've been maybe in a car accident or something. You know somebody's going to survive. You know they're going to do physio. You know that that physiotherapy is going to take a period of time, then they're going to get out of hospital. And there's a big push, particularly in the UK, with the health technology councils they have there. They've realised in the NHS, they're not great at spending money, but they've realised that, that there's expensive technologies that may well have a cost benefit, but they've blocked looking at them just because it's expensive. They haven't even got to do the calculation, and what they're saying now is that if they actually start rehabilitation earlier, then they're getting people out of hospital quicker, which is good for everyone. It's good for the end cost for the hospitals, but it's good for the patients too. And so we're looking at cases of having devices like this, although not exactly the same, much lighter weight, that people will be wearing in a bed, and physiotherapy, performing physiotherapy automatically in the bed space to get them out of hospital quicker. So it's a technology that will change and move and really isn't limited by what we see just now. We've looked at stroke rehabilitation for arms, we've looked at enhancing strength in people's hands and fingers, and all these things will change. And it's related to other areas as well, because we look at functional electrical stimulation, we look at muscle power and EMG, and we look at sort of enhancing and working with those and with pressure as well. So all those things can be applied to beds, to legs, in lots of different places. So it's a real suite of technology that we're looking at, but always in that assisting with mobility and functional impairment. That's a 50-kilo machine. Depends between about 40 and 50 kilos. The user doesn't feel any of that weight because the machine carries them, not the other way around, or the machine facilitates them. Most of the weight goes through the user's own feet, about 60%. And we did that specifically so that people could weight bear, impact their long bones, keep the mineral density up in the bones. So it was but not a full weight bearing, because most people are osteopenic, osteoporotic after time in a chair.
Presumably it's battery operated.
It is.
And how much activity do you get out of one charge?
We have two different devices, so one's a personal and one's a rehab device. This is a personal device, and you get over 2 hours of constant walking in it. So for most of us, we don't walk 2 hours in a day, that'll last you all day. We sometimes joke that we invented the perpetual motion machine, it hardly ever needs charged.
Have you got a warning device that you've got 10 minutes before you run out of steam?
Yeah, absolutely. I mean, that's a big requirement. And it only takes 30 seconds to swap the battery. I'll just show you just now.
How many are in service? How many machines are there?
Probably about 30 or something just now. There's an awful lot more coming on. Since we've been funded, we've actually been building the company rather than building machines, so there's an awful lot of growth required with an AIM-listed company, a lot of compliance, and so we've moved to a larger factory in Auckland now. Everything is designed and built here in New Zealand, with the exception of the plastic covers, because nobody makes bits of plastic that big in New Zealand. A very proud Kiwi company, and everything is done in here, and so we've been expanding our supply base and our factory facilities, and actually coming up to scratch with all the medical standards around the world, so FDA compliance, ISO 13485, manufacturing and general manufacturing practices for the States. So, and the machine is CE marked and it's FDA approved as well.